Thank you, thank you, thank you, National Science Foundation. You guys have put together a 3-day program, a sleep show, that talks about how sleep impacts our health. 3 days to discover, 3 days to learn how to feel better, learn how to live longer, learn how to feel good about going to sleep and be positive about it. And I appreciate the opportunity to learn and appreciate to be here and the excitement and the progression of knowledge in this area. Go Sleep Foundation. My focus in sleep perhaps started about 10 years ago. My mother, in her early 80s, late 70s, early 80s, in her sleep, kept falling out of bed. So she broke a rib. Then she broke an arm. And eventually she broke her back. Now when you're that old, recuperation is not good. And it was difficult to see her suffer. It was the recuperation for her was terrible, and getting off the medications. It was a long haul. And I felt helpless. I had no idea what was going on in her sleep that would cause all these problems that make her fall out of bed. And I felt helpless and had no idea what was going on. I happened to be a dentist, and thank goodness, right about that time, I went to a continuing education program that talked about occlusion, which just means how do the teeth come together. And part of that class about occlusion, or how the teeth come together, was what the teeth are doing at night when we may be not breathing very well. And so the grinding associated with the struggle to breathe. And so what I learned was, wow, during the day, we're all sitting here, we're breathing, our airway's open, we've got a little tube from here into our lungs, and air's going back and forth so nicely. When we go to bed, in some of us, not all of us, in some of us, the airway, the muscles relax, and the airway can get, that tube kind of gets a little collapsed, and sometimes the tongue falls back, and the soft palate falls back, and you get a very slow amount of air flowing or no air flowing. And that sleep disordered breathing is very much associated with the grinding. And what the grinding does, instead of being back and everything falling back, the jaw comes forward when you grind, the back of the tongue comes forward, the back of the soft palate comes forward, and those muscles tighten up and the airway opens. Well, no wonder people grind. It helps them to breathe. It helps them to live. It is a survival mechanism that allows them to live. And if it means wearing the teeth down, oh well. And if it means having the jaw joint hurts, oh well. So this was a huge shift, because as dentists we had always been taught that, hey, you grind because your teeth aren't comfortable, so their teeth come together in the wrong way. None of the vision was about the grinding was to help you breathe. So that was a wonderful way of seeing how people need to breathe at night. So I took this information, I came home with my mother, and we sent her to a sleep doctor, and sure enough, she went to a sleep lab, and my mother she would stop breathing 21 times an hour. She'd stop breathing for 10 seconds or more, 21 times an hour. So that's once about every 3 minutes. Now the body, when it feels in danger or it's in survival mode, it will cause a reaction. It will say, hey, this is not good, and it puts out a sympathetic, or it gets aroused. Your brain says, I need for you to breathe. And in my mother's case, her arousals, her reaction to the danger of suffocating were so extreme that she actually kept falling out of bed. So, how do you help people breathe at night? How do you keep that airway open so they don't have to grind, they don't have to have joint pain, and they don't have to fall out of bed? How do you help people? In 1950s, there was a gentleman in Australia that was brilliant and took a vacuum cleaner and made it go the other direction and basically made air that goes in. It's a little tube that pushes air into your nose and into your lungs to help hold that airway open. Hold everything open so you can breathe. And that's called continuous positive air pressure. CPAP, CPAP, continuous positive air pressure. You blow the air in to keep the airway open. For whatever reason, that experience for my mother was terrifying. It was terrifying. She got hysterical. She felt like she was smothering. Her reaction to that was a visceral, total rejection, and there wasn't any way we were going to be doing that. Thank goodness I am a dentist. Thank you goodness, thank you goodness, thank you goodness. Because there is another way of treating that, which is kind of like what we used to learn, what I learned in CPR, the way they taught it a long time ago, was ABC, airway, breathing, circulation. So the first thing we used to learn was airway. You bring the jaw forward, which pulls the airway open. So a dental appliance basically kind of holds the jaw forward a little bit. And when you hold the jaw forward a little bit, with your teeth, it just kind of goes in your mouth and with your teeth, holds the jaw forward a little bit. So then that pulls the back of the tongue forward, that pulls the soft palate forward, and you can breathe. So I wanted to confirm, yes, in fact, that I was helping to treat her sleep apnea. So we sent her to a sleep study, and yes, she went from not breathing 21 times an hour to not breathing 1 time an hour, which is considered normal. So it was very exciting for me to see how you can help someone breathe, which has so much repercussions in all of your health. Because when you don't breathe, the amount of oxygen circulating in your bloodstream reduces, and then the low saturate that fluctuation of how much oxygen is going in your bloodstream from breathing, not breathing, and then breathing a lot, and then not breathing, that causes a lot of stress. So it felt wonderful to help her treat something that has such negative impact on her. And since then, because it feels so wonderful to help people live longer, I've been fortunate to be able to learn more and be very involved in making the dental appliances. In fact, sometimes we even make appliances for folks that need both. So some people can do well with the CPAP, some people can do well with the oral appliance, and some people struggle with the CPAP because there's a lot of pressure, so we can make an oral appliance to make the CPAP a better option for them. So, I feel so privileged to have learned about something that can help people breathe at night, which allows them to feel better, live longer, and oftentimes they get back in bed with their partner, because oftentimes the snoring has been such a bad influence on the partner who can't sleep, so that now with an oral appliance they can get back in bed with their partner, and that's always good too. So I feel blessed and lucky, and I feel very grateful to have learned about this device that helps people breathe and feel good. And I welcome any questions.